Hello and welcome to the Eating, Drinking and Swallowing Awareness e-learning. This is brought to you by speech and language therapists in the Learning Disabilities Specialist Health team. Ensure you are able to both see and hear the video and wear headphones if you need to. Due to the current COVID-19 public health crisis, we've cancelled some of our upcoming face-to-face dysphagia awareness training. This e-learning module has been developed to give carers and managers some basic knowledge about eating and drinking. We recommend that after the public health crisis is over, you attend one of our face-to-face practical training sessions, which will include more information about mealtime support strategies and the modification of food and drink. A little bit about us first. We are a team of speech and language therapists who cover the county of Somerset. We work with adults with learning disabilities who need assessment and advice around eating, drinking and swallowing, as well as communication. We work as part of a team of professionals including nurses, dietitians, occupational therapists, physiotherapists, psychologists and psychiatrists. The general aim of our work is to improve access to healthcare for people with learning disabilities. Due to COVID-19, we have had to temporarily change the way we work. In line with national guidelines, we are only carrying out direct assessments where there is a high risk associated with eating and drinking. These assessments might be in the form of Skype, video, or observing from an outside space. We are still processing referrals and doing our work from a distance. It is vitally important that you still make referrals to us if there are risks. Our referrals email address is there in the corner of the screen and will be on screen at the end of this presentation as well. Grab something to eat and drink so you can eat along with us while we describe how the swallowing process works. You will also need a pen and paper. Pause this video while you get what you need. First, let's look at all the different parts of the head and neck that we use when we eat and drink. There are lots and lots of muscles and processes that work together in a complicated way to swallow food and drink safely. On the left there you can see some familiar things like the nose, upper and lower lips and teeth. The hard palate is another name for the roof of your mouth. If you run your tongue along the roof of your mouth from front to back, eventually it becomes the soft palate, which you can see labelled on the right of this diagram. When you swallow, the soft palate tenses up and stops food and drink from coming out of your nose. On the right of the diagram are a few other terms you might not be familiar with. The pharynx is the area in your throat where swallowing takes place. The epiglottis is a flap of cartilage which closes off your airway when you swallow and stops food and drink going down the wrong way into your lungs. The trachea or windpipe is a rigid tube at the front of your neck which you use to let air in and out of your lungs when you breathe. The esophagus or food pipe is a muscular tube which connects your throat to your stomach. You can see that the top of the windpipe and the top of the food pipe are very close together. This is why things can sometimes go down the wrong way into the lungs. So, on the right of this screen you can see the same view of the head and neck, and this person is eating a bite of pizza. This person has a normal swallow. Normal swallowing is fast, well coordinated and highly adaptable. Adaptable meaning we can change how we swallow to suit any texture of food or drink we are consuming. In a well-timed sequence, food is chewed by the teeth, controlled by the lips and tongue, and parcelled up and swallowed via the throat, down the food pipe and into the stomach. All of this happens in a matter of seconds. This is an X-ray video of another person with a normal swallow. You can see all the fluid goes down the food pipe at the back of the throat, and none of it goes down the windpipe at the front of the neck. The windpipe is that lighter area at the front. Rewind the video a little if you would like to see this X-ray play a few more times. Normal swallowing happens in 4 stages: pre-oral, oral, pharyngeal and esophageal. We'll talk about each stage in detail. You will have some food and drink in front of you now. During the next few slides, take some small bites and sips and think about what's happening. Think carefully about what happens in your mouth and throat and what all the parts are doing. Think about whether you're doing those things on purpose or if they are automatic. And then think about how that stage might be different for someone with a swallowing difficulty or someone with complex health needs. The first stage of swallowing is what we call the pre-oral stage. This is before the food or drink even gets to your mouth, when you're getting ready to eat or drink. What's happening to your body? You might be thinking about the food or drink, cooking, setting the table, looking at the food, smelling it. Looking forward to eating might mean you're producing saliva. You might be sitting at the table, picking up your utensils and bringing the food or drink towards your mouth. We subconsciously assess risk when we eat. For example, we identify if the food or drink is too hot and either wait for it to cool down or blow on it to cool it down. We know how much we can safely put in our mouths. We know if food needs a bit more preparation or a bit more cooking. Think about how all of that might be different for a service user you support. Do they have the ability to do all those little risk assessments before they eat? Would they be aware of the temperature and texture of the food and drink, and know how to make their own food safer to eat? Do they have difficulties seeing or smelling the food? How would that affect their saliva production and readiness for the mealtime? Are they able to help with preparation of the food themselves? How could you help them to get ready to eat and drink to compensate for the difficulties they have? If you like, pause the video and make notes about the service user you support. The second stage of swallowing is the oral stage. Oral means in the mouth. Go ahead and take a bite of the food in front of you. We have some control over this stage of swallowing. After food is placed in the mouth, we use our lips, tongue and teeth to break the food down and get it ready to be swallowed. Think about how chewing might change depending on what you're eating. How would it be different if you were eating a grape versus a biscuit? How would the oral stage be different if you were eating something smooth like a custard or yogurt? How about if you just had a sip of water? Again, think about the service user who might have difficulty at this stage. What do they find difficult and why? Maybe they have difficulty chewing. Is this because they have no teeth? Is it because they find the coordination of all those muscles difficult? Do they find certain foods like grapes and biscuits difficult, but smoother foods like yogurt or custard easier? How could you make chewing easier for them? Pause the video and make some notes about the person you support. The third stage of swallowing is the pharyngeal stage. Pharyngeal, like the word pharynx, means in the throat. Unlike the oral stage, we don't have much control over what happens in the throat. When the swallowing reflex is triggered, lots of things happen almost at once. The soft palate blocks off the passage to the nose, our throat muscles contract and close off our airway, we stop breathing, and muscles push the food or drink down towards the food pipe. How might the pharyngeal stage be different with a sip of water? Again, it would happen much more quickly. Think about your service user. What do they have problems with? Is food or drink going down the wrong way into the lungs? Do they find it difficult to coordinate breathing and swallowing? These questions are a lot harder to answer because we can't see into someone's throat. Pause the video and make some notes about the person you support. Finally, the esophageal stage. Esophageal means in the esophagus. Remember, the esophagus is the food pipe which transports food from the throat to the stomach. There are little doorways or sphincters at the top and bottom of the esophagus. These open at just the right time to let food in and out. Muscles in the esophagus contract in a motion called peristalsis to push food down towards the stomach. This takes around 10 seconds. Speech and language therapists don't know everything about this part of the swallow, so it's best to seek advice from a doctor, such as a GP or gastroenterologist, if you think someone might have an esophageal difficulty, such as acid reflux. So, what is dysphagia? I'll give you a few moments to write down what you think it is. Dysphagia is a physical difficulty with eating, drinking and swallowing. It can affect any of the stages of the swallow we've just talked about. Dysphagia is caused by other health conditions such as dementia, cerebral palsy, brain injuries, strokes, as well as many of the underlying conditions that can cause learning disabilities. Other factors can make eating and drinking less safe, such as behaviours that challenge, such as cramming, needing assistance to eat and drink, being distracted by the environment, or mental health issues such as anxiety. It's likely that lots of the people you work with have a combination of factors which impact on their safety when swallowing. We'll talk about all the symptoms of dysphagia and how to make referrals to speech and language therapy at the end of this presentation. So what are some of the health risks for someone who has difficulty eating, drinking and swallowing? Here are some of the main ones. Choking, aspiration, which means things going down the wrong way, poor chest health or chest infections, weight loss and malnutrition, dehydration, poor quality of life. Quality of life and the enjoyment of mealtimes is extremely important. Eating and drinking is so much more than just nutrition and hydration. It's something that should be sociable, enjoyable and pleasurable. We always want the service user to be involved wherever possible in decisions about what they eat and drink, and sometimes this can be a balancing act with the other risks. We'll talk about these other risks now. First of all, choking. Choking happens when the airway is blocked by something, and as we know can be very dangerous. Many things can put people at a higher risk of choking, such as poor oral health and dentition, cramming behaviour, pica, which is when people are compelled to eat objects which are not food, the effects of medication, and swallowing difficulties. In the picture on the left, look at the blue arrow. It's pointing to a lump of food which is stuck at the top of the windpipe, blocking the airway. It's very important that all carers have had training in basic life support, including how to manage a choking incident. If you haven't had training in choking incidents yet, ask a manager. This is a really great website made by the Belfast Health and Social Care Trust called Help Stop Choking. It's got loads of great resources made by and for people with learning disabilities about how to reduce the risk of choking. The link to this website was included in the email with this presentation. Next, aspiration. This is when material goes down the wrong way into the airway. This can be food, drink, saliva, or even stomach contents. Most of us would cough or become wheezy if we aspirated something, but some people don't show any symptoms at all when they aspirate. This is called silent aspiration. In the picture, the red dot represents some particles which have gone the wrong way into the lungs. If you think someone has inhaled vomit or stomach contents, call 999 immediately. This is another X-ray that shows aspiration of some fluids into the airway. You can see that most of the liquid goes down the food pipe at the back of the throat on the right of this image, but quite a lot of it trickles down the front of the throat on the left and into the airway. You can also see after the swallow that some liquid is left in the throat after the person has swallowed. Rewind this video a little if you would like to see the X-ray play a few more times. A severe chest infection caused by things going down the wrong way is called aspiration pneumonia. This is an infection caused by harmful bacteria entering the lungs. It's important to know that it's the bacteria that causes the infection, not the food or drink that went down the wrong way. We can reduce a person's risk of developing aspiration pneumonia by making sure their oral care is really good quality, so they don't inhale any nasty bacteria, and making regular appointments with the dentist. Other things that make aspiration pneumonia more likely include if the person has reduced mobility, if they need support to eat, drink and brush their teeth, if they're not being supported properly, or they have an immune deficiency. We all have times when things go down the wrong way, and it's normal for this to happen sometimes. However, depending on those other factors, someone's likelihood of developing aspiration pneumonia could be much higher. Malnutrition happens when you don't get the right amount of nutrients in your diet. This can lead to weight loss or obesity, feeling tired, low mood, reduced muscle strength, increased risk of infection and illness, slower wound healing, increased risk of falls, and reduced quality of life. It is important to ensure that service users are weighed frequently and in a consistent way. Dehydration is when you don't take in enough fluids. This can lead to strong urine, feeling dizzy, getting headaches, feeling tired, feeling confused, dry mouth, lips and eyes, urinating fewer than 4 times a day, urinary tract infections, constipation. At the bottom of this slide you can see an easy way of determining if someone is dehydrated. Check the colour of someone's urine against this colour chart. The darker their urine, the more dehydrated they are likely to be. Speech and language therapists aim to address some or all of the risks we've just talked about in an eating and drinking care plan. Some of the people you support will already have eating and drinking care plans. These care plans contain essential information about how to support the service user to eat and drink. The care plan needs to be followed at all times by everyone who supports the person to eat and drink. If you are supporting someone who has an eating and drinking care plan, you must read it before you prepare food and drinks for them and before you support them to eat or drink. The general layout of the eating and drinking care plan might look something like this. The order of contents will change depending on the individual. The care plan contains instructions about how to support the person to eat and drink, including the texture of food and drink, the support and equipment they need, positioning and the environment, and other important things like oral care, medication and nutrition. Our contact details will always be at the bottom of the care plan in case you need to get in touch with us. There will also always be a list of reasons to contact us, for example if the person starts to struggle to eat or drink. We'll talk about a few of the sections of the care plan now. Firstly, food and drink. You may have noticed that the way we describe food and fluid textures has changed. We now work to a set of standards known as IDSI, which stands for the International Dysphagia Diet Standardization Initiative. This is the new system for describing and testing the texture of food and drink. The IDSI diagram here contains all the textures in one place for food and drink. They are labelled with levels 0 to 7 and colour-coded. Food is on the left and fluids are on the right. You will notice that food and drink overlap in the middle, as pureed and liquidised food is basically the same texture as thicker fluids. I'll give a brief overview of each food texture. Please go to the IDSI website, idsi.org, for more detailed food texture description sheets. At the top of the IDSI diagram, levels 7 to 3 make up the food textures. Level 7 is split into regular and easy to chew. Regular covers all the textures that food can possibly be, including foods which have a higher risk of causing choking. Level 7 easy to chew food is soft, tender and moist, usually recommended to people who don't have many teeth or have a mild difficulty with chewing. This level takes out all the really high-risk food. Level 6 is soft and bite-sized. This is a similar texture to level 7 easy to chew, but cut into bite-sized pieces. For an adult, bite size means 1.5 centimetres or 15 millimetres square. This is about the size of a 5p coin. Level 5, minced and moist, is food that is mashed down so that individual lumps are no bigger than 4 millimetres. Level 4, pureed, which is the same as level 4, extremely thick liquid, is completely smooth with no lumps whatsoever. It is thick and holds its shape on a spoon. Level 3, liquidised, which is the same as level 3, moderately thick liquid, is completely smooth but runnier than level 4. Carrying on down the diagram, now on the right, level 2, mildly thick, and level 1, slightly thick, refer to consistencies of naturally thick or thickened liquids. Level 0, thin, is normal fluid, for example, water. We explore how to modify and test food and fluid textures at the face-to-face training. In the meantime, for advice on thickening liquids, follow the instructions on your tin of thickener. If you have any questions about an eating and drinking care plan, discuss it with your manager or dysphagia link worker. If you still have questions, the speech and language therapists in our team are happy to help. We mentioned high-risk foods which may be more likely to cause choking. Here's another resource from the Belfast Trust and the Help Stop Choking website. It's a list of foods which are thought to be high risk for people with swallowing difficulties and which you could exercise more caution around if a service user has behaviours such as cramming. The Eating and Drinking Care Plan will list which foods are considered to be high risk for the specific individual or where certain foods have been assessed by a speech and language therapist. The Eating and Drinking Care Plan will also tell you what the person's support needs are at mealtimes. Here are a few terms we might use in the support section of the care plan. However, these are just general definitions. Individual service users will have specific needs which are addressed in their care plan. If we have said one-to-one or close supervision, this means that you should sit at the table next to the person so you can provide physical assistance or prompting. Distant supervision means you don't have to sit physically close to the person, but should be in the room at all times so you can provide prompting if needed and so you can be vigilant for any difficulties the person might have. You must not leave the room at any time. We will always write in the care plan about the person's optimal positioning for eating and drinking. For most people, this will be sitting upright with their head in the midline and the feet supported. We talked a little bit about the importance of good oral care earlier. Good oral health is essential for reducing the risk of chest infections, heart problems, oral infections, poor quality of life and discomfort. The people we support need high quality oral care at least twice per day, and many may need support to brush their teeth, whether that be verbal prompts or physical assistance. Some people need oral care more often. For example, if they need help clearing food from their mouth after meals. For people with no teeth, oral care is still incredibly important and a toothbrush and toothpaste should still be used. Some people are unable to eat and drink safely and need to receive nutrition and hydration via other means. This might mean receiving food and drink through tubes which get to the digestive system from outside the body. You might hear the terms PEG, NG and RIG, which refer to the way feeding tubes might be inserted. For example, PEG, or percutaneous endoscopic gastrostomy, is a tube going through the belly into the stomach, whereas NG, or nasogastric tube, is one that goes down the nose and throat into the stomach. Having a feeding tube doesn't necessarily mean the person will never eat and drink again. They might have small amounts of food and drink orally, or go back to eating and drinking orally again in the future. People with dysphagia may not be able to swallow solid dose medications like tablets and capsules. If you think someone is having difficulty swallowing their medication, you will need to talk to their pharmacist or GP about how to administer medication in an easier form. You should never change the way medication is given to a person without consulting the prescriber first. So, to summarise how to reduce someone's risk of having negative health outcomes when they have an eating and drinking difficulty. Always follow the Eating and Drinking Care Plan, which has been written by a speech and language therapist. Do not copy the care plan onto any other document. If you have any concerns about someone's eating and drinking, talk to your manager or dysphagia link worker. All referrals to speech and language therapy come to us via our single point of access email address, which is there. Ensure every service user has high quality, regular oral care. Ensure every service user's seating posture is supportive and stable. You can refer to physiotherapy using the same email address above. Make sure you monitor service users' weight and hydration, so if they are malnourished or dehydrated, you can act quickly by letting their GP know. This poster has been attached to the email containing this presentation. It's a good one to print off and display in your dining room. It has some general common sense hints and tips about how to make mealtimes safe and enjoyable for the people you support. What are the signs of dysphagia? These are the main signs and symptoms to look out for. If someone you support has any of these symptoms, make a referral to us through your manager or dysphagia link worker. Coughing when eating and or drinking, choking incidents, frequent chest infections, a reluctance to eat or drink or mealtimes taking a long time, sudden or gradual weight loss, someone's breathing changes, so sounding wheezy, gasping or gurgly during mealtimes or after eating or drinking, a wet sounding voice during or after eating and drinking, difficulties with chewing or difficulties with swallowing, poor management of saliva, so drooling or dry mouth, poor oral hygiene, effects of change in medication, sorting out of certain textures, so when someone picks lumps of food out of their mouth. It's important that you tell someone's GP about any symptoms they might have, as well as referring to speech and language therapy, because swallowing difficulties can be a sign of a new health problem. Managers and key workers need to monitor and manage the level of risk for people with eating and drinking needs, so that they make timely referrals to speech and language therapy. In the email containing this presentation, we attached the National Patient Safety Agency, or NPSA, Dysphagia Risk Assessment tool. This can be used to monitor changes to a person's level of risk associated with their eating and drinking needs. Care providers should have their own risk assessments for providing support at mealtimes. It's important that these make reference to the eating and drinking care plan, but do not replace the care plan. If you have concerns about a person's eating, drinking or swallowing, all referrals to speech and language therapy come to us via our single point of access email address, which is there again. We will assess the risk over the phone and provide advice. If the person has choked, we will ask you to complete a choking risk assessment to establish which factors may have contributed to the incident. We will assess whether a face-to-face visit is essential and how this could be supported. As carers, you will have a lot of knowledge and experience of the person you support, which is essential to our assessment. We may ask you for written records or video evidence if we are unable to see the person face-to-face. Thank you so much in advance for helping us with this. On behalf of the Speech and Language Therapists and the Learning Disabilities Specialist Health Team, thank you very much for watching, keep well and stay safe.